There are two methods of standard ECG leads placement. One is according to American Heart Association, and other one is according to International Electrotechnical Commission. In this video, we're talking about how correctly place 5 leads ECG to a patient using above both methods, and also simple tips to memorize it. According to American Heart Association, for shorter NA, white lead to right arm, and then green lead to right leg. Next, black lead to left arm, and red lead to left leg. Finally, brown lead to middle of the chest. Now let's discuss a simple tip to memorize this. Remember white is in the right side, and so remember white right. Then remember grass over clouds, so green lead is to right bottom area. Then remember fire over smoke, so black is in the left upper area in the chest, and red to the left lower area of the chest. Now, let's discuss how to place ECG leads to according to the International Electrotechnical Commission color code system. Red lead to right upper area of the chest, black lead to right lower area of the chest, yellow lead to left upper, and green to left lower area, finally white to the middle area of the chest. Now, let's see a tip to keep this in memory. Green lead, which is marked as F lead to left lower area of the chest, remember F to left lower. Then remember sun over grass, yellow lead to left upper area of the chest. After that, remember red to right. Place red lead to right upper area of the chest. Finally, place black lead to right lower area of the chest. Then white lead is in the middle of the chest. You can also download simple mnemonic of this lesson from our Facebook group Nursing Educare. Link is in the description.